Hello, hello. My name is Jess Wonders, and I am here to give you your bonus part 4 in the what I previously called 3-part series of the supplements and herbal remedies for pre and post-op. So the original course included 3, and I have found homeopathic remedies to be extremely helpful in my own personal healing journey. So I thought I gotta share this stuff with you guys too. Let's get into it as I share my screen. All right. Now, homeopathy or homeopathy or homopathy, however you want to pronounce it, because I've heard it so many different ways. According to the Society of Homeopaths, homeopathy is a system of medicine which involves treating the individual with highly diluted substance given mainly in tablet form with the aim of triggering the body's natural system of healing. Many remedies are used to treat pain and swelling in many parts of Europe and South America without side effects. There are even veterinarians who use homeopathy on animals in America. I'm sure elsewhere too, guys. Arnica 30C helps with pain from swelling, lacerations, bruising, and general trauma to an area. The main ingredient is tramiel, which I've previously mentioned if you watched the other videos in this series. You would take 3 to 4 pellets twice per day, dissolved under the tongue, on the day before surgery and also as soon before surgery as possible. So you would take this one with you to the hospital. Take as soon as possible once you get into the recovery room after your anesthesiologist. Your anesthesiologist can help with this or wait until you are back in your room. And then take the same dose daily for a week following surgery. Arnica is good at preventing ill effects from any kind of physical trauma. So that's why we like this one so much, which surgery is physical trauma to the body. Hypericum 30C helps with nerve pain, traumatized or inflamed nerve pain. Start with the 30C, then progress to Hypericum 200X if nerve pain still is persistent. Phosphorus 30C, this reduces negative side effects of anesthesia and inhibits excessive bleeding. Take 1 tablet 4 times a day for the week after surgery. Carbo-Veg 30C. This is helpful for all laparoscopic surgeries. I'm looking at you, endometriosis community, where surgeons inflate the abdomen with CO2 gas. This reduces the side effect of that CO2 gas, which often refers pain into the right shoulder after laparoscopic surgeries. Unless you keep your mouth closed and don't talk too much, then you can avoid that too. Take 1 tablet every 15 minutes until the pain subsides, or take 1 every few hours after surgery to prevent the pain from developing. All right, we've got 200C of Staphygaria. Staphygaria. You know what? I'm human. And I used to win all the spelling bees, but when it comes to pronouncing some words, man, I struggle. All right. Useful for mild post-operative internal bleeding. Abdominal surgery would be an example of that. Place 1 tablet in a water bottle and sip throughout the day. Take 4 to 6 doses until the bleeding subsides. If bleeding persists, consult your doctor. Hippeal relieves nausea and abdominal discomfort and referred shoulder pain from CO2 gases used in laparoscopic surgery. Rescue remedy. I actually used this one when I was preparing for natural birth that ended in a C-section. But anyways, I still found it helpful. Formulated to treat shock and trauma incurred from accidents, injuries, or emotional traumas. As you can see, a C-section is very much a physical trauma and injury to the body. So yeah, I'm glad that I was using rescue remedy for the days leading up to birth. It may be taken prior to surgery and will not interfere with any medications. It's helpful after surgery to ease any persistent feeling of trauma. So you can take this one for a while after. Chinese herb Yunnan Bio promotes wound healing and enhances ability of the blood to clot. Results in decreased swelling and bruising. 1 tablet 4 times per day for 1 week prior to surgery and continuing for 1 month post-op. Start as soon after surgery as you can. Take things by mouth. Laparoscopic Laparoscopic abdominal surgery. I'm looking at you, endometriosis community. WOB enzyme N3 tab, 3x a day, so 3 times a day, 14 to 15 days before surgery. Traumil, 5 to 10 tablets a day until the day of surgery. Antioxidant formula, 30 days to 7 days before surgery, with probiotics, about 3 doses, 14 days before surgery and after surgery. Multivitamin, 1 dose AM, so 1 dose in the morning, multimineral, 1 dose PM of Rescue Remedy, 1 to 10 doses before and after surgery. Hepil, 1 tablet 4 times a day for shoulder pain from gas. Carbo Veg 30C, 1 tablet post-surgery 4 to 5 times a day. This is going to be in your course materials written out for you to refer back to. So anybody having laparoscopic deep excision surgery, which is a form of laparoscopic surgery, abdominal surgeries, pelvic pain related surgeries, you guys can benefit from this entire breakdown I just listed. Pain management. Rescue Remedy, 1 to 10 doses before and after surgery. Traumil. So this would be the protocol you would follow using homeopathic medicines for pain management. You would do Traumil, you would do Hepil, you would do proteolytic enzymes, and then that's the breakdown. This will be in your information after. Fish oil. A recent study found that fish oil supplementation after major abdominal surgery resulted in better functioning of the liver and pancreas. This protection resulted in a more rapid recovery. Most of the research suggests that you should begin supplementation with omega-3 fats, fish oil or EPA, and glutamine for at least 1 month before surgery. Remember to stop taking omega-3s 1 week before surgery, though, to cut down the risk of excessive bleeding. So that's omega-3s specifically. Now, supplements and herbs to avoid pre-surgically. Some foods and supplements have blood thinning effects and interact with medications or affect blood pressure. Depending on the type of surgery and your health condition, these supplements should not be taken 2 weeks before surgery. Excuse me. A laparoscopic surgery may not be as invasive as other surgeries and may allow the use of supplements closer to the time of surgery, so speak with your surgeon. Consult with your physician and surgeon about discontinuing these foods and supplements 1 to 2 weeks before surgery, especially if you are on blood thinners as well. Now, bromelain. Discontinue use 1 week before surgery or earlier if your physician suggests. EPA, DHA fish oils decrease stickiness and clumping of platelets, decreases, excuse me. Vitamin E impairs wound healing and decreases stickiness of platelets. Hawthorn berry decreases the clotting ability of blood, but exact mechanism by which this occurs has not been clarified really. So selenium, possibly. So has some anti-clotting properties, that would be why, especially when taken with vitamin E. A few others you should avoid in the 2 weeks before surgery would be chamomile, devil's claw, ginkgo biloba, feverfew, kava kava, licorice, and St. John's wort. Now, herbs that may inhibit platelet aggregation. So this is a concern. These would be a risk of hemorrhage when taken with NSAIDs or other blood thinning drugs. NSAIDs are things like Advil and Motrin. So aloe vera, bilberry, bromelain, devil's claw, dong quai, feverfew, flaxseed oil, garlic, ginger, ginkgo, excuse me, and grapeseed extract. Herbs that may inhibit clotting concern. Potential for excessive bleeding during surgery. That would be chamomile, dandelion root, dong quai, ginseng, and hoar chestnut. Herbal medicine. Few surgeons question patients regarding their use of herbal medicines, and 70% of patients do not reveal their use of herbal medicines to their physicians and pharmacists. Many herbal remedies possess significant pharmacological activity and consequently potential adverse effects and drug interactions. Skeptics need only take a few doses of the botanical laxative senna to become convinced of the herb's clinical efficacy. That is a quote by Dr. Simon Mills. If you've ever taken senna, you understand this wholeheartedly. I'm just thinking about the first time I took, I think it's the Yogi brand Smooth Move tea, which has senna. My world was changed that day, guys. All extracts are not the same. The California Department of Health Services Food and Drug Branch investigated these Asian patent medicines collected from California retail herbal stores and found that 83 of 260 products contain undeclared pharmaceuticals or potentially hazardous levels of lead, arsenic, and mercury. So make sure you are really doing your homework on the source of these herbs and homeopathic remedies, okay? And I, of course, will give you places that I recommend you check out for yourself as well. That'll be in your guide. Now, it is advised to select manufacturers, typically European, who use methods such as high-performing liquid chromatography to generate a characteristic fingerprint spectrum, which they use to maintain consistency across batches. Practitioners should select manufacturers from countries so that so if like you were working with an integrative medicine doctor, functional medicine doctor, this is the protocol you should ask them like that they're following, or also for you to follow as well. So you should select manufacturers from countries including those in Europe, Japan, and Australia, where herbal medicines must by law be made according to the Code of Pharmaceutical Good Manufacturing Practices. GMP is also what that. Okay. Herbs that may increase the depressant effects of anesthesia concern. Potential prolonging of the sedative effects of anesthesia would be hops, kava kava, passion flower, and valerian. And then miscellaneous herbs of potential concern. Echinacea, this affects immunosuppressive drugs. It may cause liver damage when combined with anti-rheumatic drugs. And ephedra can cause cardiac stress and stroke. And St. John's wort alters the metabolism of many drugs, so their absorption would be highly distorted. That's a wrap. My name is Jessica Wonders. You can find me at jessicawonders.com, endowonders.com, or on social media at Sunfire Poppy on TikTok, Instagram, and Facebook. As always, demand better care, period.